We focus on the diabetes and always try to keep it under probably tighter control than you may see with some of your other family members or friends that are not pregnant, specifically so we can minimize the complications of the diabetes. Gestational diabetes is diabetes that you acquire during the pregnancy. So it is not pre-existing, it just happens during the pregnancy. And basically it's an imbalance of your carbohydrates. In pregnancy, the hormones cause you to be a bit insulin resistant. And insulin is what you need to control your sugars. So if you're insulin resistant, your carbohydrates, or basically your sugars, are not going to be well controlled, and you'll be diagnosed with gestational diabetes. If you're overweight or obese, and there are specific guidelines for that, and you have say a family history of diabetes, or you had diabetes in a previous pregnancy, you've had a large baby before, you have something called polycystic ovarian syndrome, your hemoglobin A1C, which is just a marker of how your sugars have done over the past few months, if that's elevated above 5.7, those in existence with the obesity put you more at risk for diabetes. Any of those are diagnosed during the discussion with your obstetrician. You probably should have early diabetes screening as opposed to your diabetic screening at the typical time around 24 weeks. Yes, so uncontrolled carbohydrates, uncontrolled diabetes can cause the baby to be large or overweight at birth. And how that relates to mom is you're gonna have birth trauma trying to get out a large baby, or even if it gets bad and you're having to take medications, you can have stillbirth. We focus on the diabetes and always try to keep it under probably tighter control than you may see with some of your other family members or friends that are not pregnant, where those sugars can be a little bit higher. They can live with that. But in pregnancy, we keep it very, very controlled, specifically so we can minimize the complications of the diabetes. If you are diagnosed with gestational diabetes, you want to try to be a compliant patient and make all your visits. Gaps in the visit when you're diabetic are not a good thing, because there's plenty of education that needs to be done, from the nutritionist down to a program that can watch your blood sugars to even the specialist. And it requires a lot of time and dedication on the mom's part. It can be hard. Everybody has their own social situations, but the more appointments that you miss, the harder for it is to help you. Two big answers for that are exercise and your diet. Definitely would recommend starting something, walking, whatever that may be, and then your diet. Sometimes patients think eating fruits is good for them, but there's certain fruits that are heavy in carbohydrates. Eating just pasta, I only eat pasta, I only eat rice, I only eat potatoes, it's good. Those are good starches. But if you eat too much of those, that's heavy loaded carbohydrates, and your body just cannot deal with that. So exercise and diet are the two things that are going to help you get through if you have gestational diabetes.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.